Hi, everybody. Good to see you. Today, we're going to talk about running an ethical neurofeedback practice. There are things that you need to know when you're running a practice. There's the aspect of being a good clinician, the aspect of being a good neurofeedback provider, and then the aspect of being a good business person so that you're doing things ethically and ultimately so that you don't find yourself in a mess of trouble. I think some things to think about when you're looking at the ethics of running a good practice include, first of all, the concept that now that you've gotten trained well in neurofeedback and you got your mentor and you feel confident and you feel like you can work with the clients that are coming to you, is still keeping in mind there's three roles that you're playing: being a neurofeedback practitioner, being a clinician who's offering clinical services, and being somebody who's running an office. And essentially that's being a business person. And whether we like it or not, we are a business person that's involved with insurance. Whether you're on an insurance panel or not, virtually every client we see has insurance. And so keeping that in mind as you're working, clients may not want at the outset to use insurance, and clients change their minds along the way. So I talk about the importance of keeping good records right from the start. Insurance companies are not very transparent about how to bill. There are some people in the field who are in the neurofeedback field who are very learned about this. I really point out 𝗓𝗪𝗧𝗪 is somebody who knows a lot about this. I have been doing this for many years in billing and trial and error. I've taught courses in it, but knowing what codes to bill and how to bill them and how to convey this to your clients is important. And then keeping good records of what you're doing as far as any intervention. With psychotherapy, sometimes we keep skimpy notes. With neurofeedback, it's important to keep very good detailed notes, including how many minutes did you train each time you trained. It becomes more important to have very clear accuracy about the interventions and the protocols that you did so that you can reflect on your client's progress as you go along. So these are all important things to be thinking about when you're running a practice and maintaining a practice that adheres to nice, good, clear ethical standards.